The heads of department are expected, as a matter of responsibility and in the sense of accountability, to give account of all staff under their supervision. So in so doing, we keep track about the movement of the staff,
The 360-degree improvement at FMCEB Meta is evident to both patients and staff, with many attesting to the center's dramatic progress.
When you have cases like Ebola virus and other viruses, we can do such tests as long as we can get the equipment we need and consumables.
In the last 7 years, we have developed a research, education and training department. So the department is in charge of research, education of both doctors and staff, and training of members of staff. So what we have achieved is that we have succeeded in starting residency training program in internal medicine, in general surgery, in orthopedics, in pediatrics. We have collected accreditation, full accreditation, so that doctors can be trained. Also in the radiology department, in addition to the O&G and family medicine that we were doing before.
A lot has been added to the unit. We don't just do ECG, electrocardiogram tests. We do ECG, we do lung function tests, we do aeroflowmetry tests, we do echo, we do stress ECG. So we do a lot now. It has moved from just ECG to a lot of things under the unit.
Before, we have an oxygen plant that can produce just 20 cylinders per day. But now, under this administration, we have 2 oxygen plants that can produce 60 cylinders each of 6 meter cube size of cylinder per day. So making 120 cylinders of 6 meter cube oxygen cylinder per day. So which means that we've actually been able to meet up with the demand of the hospital, because currently the hospital uses an average of 50 cylinders per day.
The resurgency of excellence at FMC represents a significant step in restoring Nigerians' trust in their healthcare system. This center now stands as a symbol of hope for better healthcare across the nation.
When I came in, we had a 16-cylinder oxygen plant that would work for 1 day and would not work for the next 3 weeks.
So we've been able to produce more, and we have a lot of reserve, unlike before that we have just 20 cylinders per day. Then also now all our wards are now piped. Before we normally use oxygen cylinders in all the wards. That poses a lot of hazards to patients and also to the ward. But nowadays we have oxygen pipes all over the ward, and then we have an oxygen manifold system that is capable of distributing oxygen to all the patient bed points in the hospital.
In the first months when we came, one of the things that drove us to EMR, and one of the things that has continued to drive us towards efficiency, is we try to identify problems. In those early days, you find out that you go to the clinics and you see patients who have been in the hospital for the past 4 or 5 hours, and they have not even seen the doctor. And it's not that there are no doctors to see them. It's also not that the doctors are not willing to see them. But you find out a subset of patients, you come in the morning, you see them, they say they are looking for their case notes. You may be surprised that you have up to 40, 50, 60 patients like that. And usually leads to conflict. The patients get angry with the medical records officers, the medical records officers get angry with the patient, and the whole thing is just a bundle of confusion.
The EMR presently, we've been using it since 2019, and it has helped in safekeeping of patients' record and easy accessibility of patients' folder, which has drastically reduced patients' waiting time. We also have a queuing system whereby when patients comes in, they swap their card, they click on the clinic they are going, it automatically gives them a token number which they print out, take to the various clinics they need to see their doctors, and they are arranged accordingly. Again, our EMR has also made patients to actually be able to see their investigation, lab, radiology at the comfort of their homes. Before now, patients will transport themselves to the hospital just to have their lab results.
In the last 5 years, we have mentored over 60 hospitals in deployment of electronic technology in healthcare. Over 60 hospitals, including tertiary hospitals, including secondary hospitals, including old states. We have received their states where they are commissioners for health, all the MDs of their hospitals, the members of their state assembly, everybody in the health system. At least 3, 4, 5 states have come, to understudy what we are doing. Okay, over 70 hospitals in this country today have adopted the same electronic medical records that we pioneered. All right, so it's been a big transformation, with all due respect. Okay, even Lagos Business School wrote a case report on what we have done
for the past 7 years, because I've also been here for the past 7 years. The healthcare here is very, very fantastic. You even see from the environment, everything there is changed. Initially, they were using a card, but when you get there now, you have your own card, and they respond. They are very effective. The healthcare here is very good. It has improved, even from different places, even not only our local government. They bring people here because they know they are very good. So it has improved a lot of our people's healthcare. So they don't have any issue with the medical center.
Apart from the equipment not readily available, personnel too were so short. But for the past 5 years now, there has been a tremendous change, whereby the new state-of-the-art of equipment for an ICU setting is on ground. We have personnel.
If I give you the kind of figures that we started with and the kind of figures we have now, you would appreciate the enormous expansion that has taken place. When we took over, the hospital beds in the hospital was about 72 beds. We're a 72 bedded hospital. Okay. Today, we are 450 bedded hospital. Okay. When we took over, we had 3 theater suites in the entire hospital, 2 main theater and 1 serving the maternity. Okay. Today, we have 12 theater suites, all fully equipped. Okay. I always tell this story. When I came to this hospital as medical director, there was only 1 single patient monitor that was not working. Today we have over 500 patient monitors. Indeed, in our hospital, every single patient has a patient monitor, and all the patient monitors are linked to a central monitoring system, which feeds into our electronic medical record. Okay, as at that time too, we had no mortuary. So we had to take corpse, okay, from our hospital to outside mortuary. Today we have a functional mortuary. At that time, we didn't have a standard CSSD, Central Sterilization Unit. And you must know that the Central Sterilization Unit is key. It's actually the glue, okay, that controls and ensures the quality of materials that you are using in the hospital, either for surgery or wound dressing or injection or whatever. Okay, we didn't have a standard one at that time, but we have today created a standard CSSD that has remained the reference point in the country. Okay, when people want to set up CSSDs now, they come here. On an annual basis, we'll probably train about 5 or 6 or 7 hospitals who send in their staff, some of them maybe up to 10 workers, okay, to train in our CSSD, okay, and Jetinj has named our CSSD as their training center in the whole of